Greetings, everyone. My name is Steve McPhail, and welcome to our Prep Hour with Steve session. I hope this finds you in good health and also progressing well in your exam preparation. Just to begin with, I'd like to find out where everyone's located and what time it is. I'm here in Brisbane on the east coast of Australia, and it's just turned 8 a.m. Friday, March 29. How about in your location? Perhaps if you're in the UK, it's not Friday yet, it might be Thursday evening. So we've got some comments coming in. We'll just have a look at those. Welcome to everyone coming in. Type in where you're located so I can see that. It's Friday morning, 1 a.m. for Fahad. Hello to Fahad. In Jeddah, okay, in Saudi Arabia, that's wonderful. Who else is here? Just type in and I'll wait for those to load up before we begin. I've got two screens going on here, so I'll have to continue to look to my right at the moment. Hello to Noor. Noor is in Sydney, a little bit south of me. It's 9 a.m. Welcome. Hello to Ahmed in Egypt, in Cairo. All right. Well, as you would have seen, the topic we're going to do today is reading part C. So how do you guys feel about reading part C? Is it a challenging part? For many people, it's perhaps the most academically challenging part of the exam. So we need to have a really good technique and good reading skills to get a good mark. So hopefully today's session will help you achieve those goals. So I'm now going to, Fahad says terrible, don't worry Fahad. We'll help you with focus to develop the skills to improve. All right, so now I'm gonna share my PowerPoint, everyone, and we'll get straight into it. Okay, so reading part C, that's going to be our focus today. So what is the reading part C exam? Well, the whole reading exam, as you will know, you have 1 hour altogether. There's 15 minutes for part A, but that's like a separate test. After part A is finished, the papers will be collected and you'll get part B and part C papers together. And you'll have a total of 45 minutes. Probably 9 or 10 minutes should be enough for part B, and then the remaining time is going to be for part C. Part C has 2 texts, and that means each text has 8 questions, so that's a total of 16 questions. If you do the math, and you've finished your part B and you've got 35 minutes remaining, per question. That's how long you'll have, about 2 minutes and 15 seconds. So time management is also an important part of your strategies, and as you're practicing at home, you should be monitoring your time. It's okay if you take a little bit longer as you're building your skills. It's good to focus on accuracy, but as you develop and as your exam date gets closer, you should be trying to manage your time so that on exam day you will be able to complete the test within the time frame. All right, each text that you're going to that you read will be roughly 800 words long, and the questions, there are 8 questions as I said, and they have 4. It's standard multiple choice question structure. So there'll be a question stem, and 4 answer choices, and it will relate to a paragraph in the text. In terms of question types, there are opinion questions and main idea questions. It's the most common. There are also vocabulary and phrase questions. Now, today we're not going to look at the vocabulary and phrase questions. We're going to look at the opinion and main idea questions. So let's look at some strategies. What we need to be, there's 3 elements here, but basically you need critical reading skills. By having critical reading skills, it means you can understand what the purpose of a text or paragraph is. The breakdown is, number 1, you have to read analytically. Now, to read analytically, it means you're going to have to read the question stem and understand it. You're going to have to read the text and try to work out that main idea. And you're going to have to read the answer choices. I suggest when you're doing this, that you have a pen in your hand and you're underlining keywords, both in the question stem and answer choices and in the text, and you're thinking deeply and analyzing it as you go. Another part of critical thinking is logical reasoning. So the answer choices very commonly will be written in different words, perhaps using synonyms or summarizing main ideas. So the answer choices will commonly have different words to the text. So, and you may have to use deduction to work out what the writer's opinion is. What we say is reading between the lines, looking for the deeper meaning. That's where we use our logical thought process to deduce the purpose or the attitude or opinion of the writer. Lastly, we have engagement. What do I mean by engagement? Well, you need to activate your mind as you're reading. You need to understand those answer choices and really start to engage with the text. It will be on a medical topic. It will be something you're interested in. Perhaps you have some degree of familiarity with it, but you need to engage with that and bring in your experience and understanding, both medically and of the world, to help you make the right decision. So engagement is important. It's not just a group of words. The words have meaning, so you have to identify that meaning. Now we're going to look at 2 strategies, everyone. We're going to look at 2 strategies to approach this. So the first one we call the QTA method. What does that mean? Well, it means read the question stem, but not the answer choices. Read the question stem, then read the text, and then read the answer choices. So QTA. Now, in terms of time management, probably allow about 15 seconds to read that question stem so you understand what it's asking you. Then read the paragraph. And as you're reading the paragraph, you're underlining keywords, you're understanding relationships between ideas. You're looking out for signal words such as but or however, or for this reason, or, you know, the way that ideas are linked together. You allow 1 minute to read your text, and then you've got 4 answer choices, and you go through each answer choice, and you're going to rule out incorrect answers and choose the answer that matches, about 1 minute. So that's your 2 minutes, 15 seconds, the average time allocated to each question. But that's self-managed. So the text we're going to look at, let's do that right now. This text comes from an OET Centre published book. It's you'll see it on the website. It might have a different color, but the text we're using is called Medication Non-Compliance, and it does come from an OET Centre produced text. We're not going to do all the questions today. We'll probably go through 5 or 6 questions. from that book. Okay, so the first one, I'm just going to show you the question only. Can everyone see that question on the screen? Question says, in the first paragraph, what is the writer's attitude towards the new program? So there must be some type of new program, but what we're really looking for here is the writer's attitude. So that's the key element here. And when you see something like this, the writer's attitude, you can't answer a question like this by just searching the text for a particular attitude, really. It's going to be a deeper meaning here. We're going to have to read between the lines. So really the best approach for a question like this is to read the paragraph and try to understand exactly what that writer's attitude is toward the new program. So what I'm going to do now, everyone, I'm going to allow you 1 minute to read that. I'm going to time this. I'm going to allow you 1 minute. All right, I'll use my watch to read the text. So are you ready? You have 1 minute from now. There it is. Okay, that time is up, everyone. Now I'm going to bring up the answer choices. And I'm going to bring up a little poll for you here, everyone. So what I'm going to do now, I'll give you another 1 minute now to make your choice. I'll give you 1 minute to make your choice, and I'm going to bring up a little poll. And when you've made your choice, I want you to click on the poll and choose whether it's A, B, C, or D. I'll give you a little bit more time. Some answers will start coming in now, I can see. So keep putting in your answers, everybody. I'll give you another 15 seconds to make your choice. Okay, and I'm going to publish the results now. All right, and we're back. So from what I can see, 71% of you chose, no one chose A, which is good because the answer isn't A. He doubts it's correctly named, but actually there was no name given in this text, so it's not A. So well done, no one chose A. Now for the next one. A couple of people chose C. Quite a lot, actually. About 30% of you chose C. Just pause for 1 minute, make sure that we can see this, everyone. Can you see the answers up there? I'll just check something. 1 moment. Okay, back again. Just a sec, everyone. Just playing with our technology here. All right. So yes, I think you can see the answers up there on your screen as well. It's the new first time we've done our poll. So some of you chose C. Now C is not correct. He's skeptical about whether it can work. I can sort of see why you'd imply that. But the question says, what's his attitude to the new program? I'll show you where the answer is. No one chose D. That was easy to rule out because it says he's more enthusiastic than other doctors, but there weren't any other doctors mentioned, so we could easily rule that out. The correct answer is actually B, everyone. Makes sense in theory, is what the text says. The concept makes sense in theory. Which concept? The concept to pay patients to take their medication. And he says it makes sense in theory, which means he understands the reason behind it. And the reason behind it is that patients often, there is a failure to comply. They don't take their medication. That's why they have considered this program. So those people who said C is skeptical about whether it can work. Well, he doesn't actually say he's skeptical anywhere there. He just says the concept makes sense in theory. Failure to comply is one of the most common reasons that patients are readmitted to hospital shortly after being discharged. So that's not given, everyone. All right. Now I'm just going to check to see if I can see your comments here. Just can't quite see the comments. All right. Does anyone have any questions about that? Fahad says, what does skeptical mean? Good question, Fahad. Skeptical means that you don't fully believe it. You're doubtful. It's the same as A, he doubts. If you doubt something, you're skeptical. So skeptical has the same meaning as doubt. And he doesn't express any doubt in this text. So that's not the answer. But that's fantastic, everyone. 69% of you got that question right. So well done if you got it right. And if you chose C, it was close, but it's not actually given there. All right. And in terms of vocabulary, I just want to show everybody something. Look at this sentence. Many a hospital chart bears the notorious comment, patient has a history of non-compliance. Can anyone tell me what notorious means? Many a hospital chart bears a notorious comment, patient has a history of non-compliance. Notorious. We have a word called famous, and notorious is connected to that, but not quite the same. Famous has a positive meaning. Notorious, seeing if any answer is coming in, it's famous for the wrong reasons, right? So in this case, a history of non-compliance is not good. So, but it's well known and famous it's written on hospital charts, but it's famous for the wrong reason. That's something that's notorious. Now, many of you have probably seen that in your workplace, I can imagine. Patient is non-compliant. All right, let's continue, everyone. So we just did the QTA method, the question, the text, and the answer. And we use that strategy because we were looking for the writer's attitude. We didn't really need to go through all the choices, A, B, C, or D. Now we're going to use a different method, everyone. This time we're going to use the QAT method. We're going to read the question, and we're going to read the answers, and then we're going to read the text. Now the QAT is, it's definitely a strategy that you will use sometimes. And in this method, we're still going to read the question stem, so we use 15 seconds. But then we're going to go through the answer choices. And why would you do this? Well, obviously, you might want to get a general idea what you're looking for. So going through each answer choice, underlining the keywords, possibly, engaging your mind and trying to choose the right answer using logic and analytical skills, you can do, but you've got about 30 seconds. The point is to engage and understand the answer choices. Then you go to the paragraph. If it's not too long, you're just going to read the whole paragraph, or you may just skim through to find the relevant section, depending what you're looking for. I will say, though, the way this test is designed, it's always good if time allows or if it's necessary to read through the whole paragraph, but you may be moving through some sections relatively quickly if necessary to find where the key sentences are. So again, allowing about 1 minute to do that. And then you've got about 30 seconds in total to rule out the incorrect answer and rule out the answer choice. So even with QAT, question first, then answer, then text, you're then finally going to have to go back to your answers to make that decision. All right, so let's try that approach, everyone. So we've got the question in the second paragraph. The writer suggests that one category of non-compliance is. So it says one category, everyone. So in our question choices, we've actually got 4 categories. So one of these categories of non-compliance is correct. So let's look at our categories. A, elderly patients who are given occasional assistance. All right, what do you think? Could they be non-compliant? Perhaps. B, patients who are overscribed with a certain drug. Could they be non-compliant? Consider that yourselves. C, busy people who mean to be compliant. Are they people who are non-compliant? Is that a category? Or C, people who are by nature wary of taking pills. Perhaps that's the answer. We don't know yet. We've got to go through our text to find out. So we've gone through our answer choices. So now we're going to go to our text. And again, we're going to do a poll. So I'll give you a total of 90 seconds from now to choose your answer. And I'll put another poll up. Start now. That's our timer, everyone. I'll give you a little bit longer, but start putting in your answers, everybody. You can see a couple of answers come through. We've got quite a few people here in the live session, but you need to commit, look at your poll, and make your decision. I'll give you another, people are still looking carefully. Give you another 10 seconds, everyone. Okay, time's up. Publishing the results. And you are an amazing audience. If you can see that there, everyone has chosen C. We got 100% on C. And that's correct. Isn't that excellent? Well done, everyone. But let's have a look. Why is that the answer? Well, we can rule out A. If we had skimmed through and we read A, elderly patients who are given assistance, well, it says the elderly and mentally impaired, US insurance companies will often pay for a daily visit by a nurse to ensure the patient gets at least one set of the most vital pills. So that means they're not going to be non-compliant because they're getting a daily visit, and they're not given occasional assistance. These elderly get daily assistance. If we look at B, patients who are overprescribed with a certain drug, well, it doesn't mention anything about being overprescribed. It does say, when we look at the text, we can see down here, they might have to take a considerable number of pills, but that doesn't mean overprescribed, doesn't mean too many. It just means they have quite a few and they're vital. So we can rule out B. And it's not C, people who are by nature wary of taking pills. Now, I'm sure that is a common reason of non-compliance. People are wary. This question is going to trap the person who didn't read the text, because it's a very tempting answer if you don't read the text, because some people are wary, hence they won't comply. But it's not something the writer suggests in this paragraph. So if we read the paragraph, we can rule that out. Correct answer is C. It's fantastic. I've got 93% correct on there. So people were saying in the beginning, a few people commented how hard part C is, but when we start to break it down, questions like this are not as difficult as you may think. And let's look at our synonyms here, everyone. So it says here, I'll read from the beginning, compliant patients take their medications because they want to live as long as possible. That's one category. Some simply do so because they're responsible, conscientious individuals by nature. Good on them. And always watch out for a word like but. When you see a but or a however, usually something very important is coming. So in this case, after the word but, the actual answer is there. But the hustle and bustle of daily life, that means busy people, right? The hustle and bustle of daily life and employment often gets in the way of taking medications, especially those that are timed inconveniently. You can imagine you're so busy at work or whatever you're doing, and then there's a medication at a certain time of day when you can't actually take it, even if you're well-intentioned. So well-intentioned means people who mean to be compliant. They want to be compliant. Hence, they are well-intentioned. Fantastic work, everyone, on getting that question right. All right, let's continue. So that's the two strategies, QTA and QAT. So now we'll go to our next question. What problem with some patients is described in the third paragraph. So we're looking for a problem here, everyone. So there's your text. Let's go for the same procedure. Give you 1 minute, and we're looking for a problem here, everyone. So you may skim through and see if you can find out what the problem is. All right, read the text, everyone. All right, we've had time now to read the text, so let's go to our questions. I'll give you another minute to choose your answer. The poll's up there now. So you've got 1 minute, everyone, to choose your answer. Some of you are typing your answer in the comment box. So try to answer using the poll function if you can. All right, and that's time's up there. You can see a few answers coming in. A few people are making decisions and changing their mind. That's a good idea too, if you can. You have to think about it, and sometimes you find another answer is more attractive. I'll give you 10 seconds, everyone. Okay, time's up. Last chance to put your answers in. I'll publish the poll. All right, so we had 3 possible answer choices. No one chose A. That's good because A wasn't mentioned. So well done if you didn't choose A. A wasn't mentioned. It's simply not given. They're not talking about them forgetting. Now, a reasonable percentage, more than 20%, chose C, right? And maybe they saw that question C, answer choice C says they don't understand their treatment even when it's explained in simple terms. But this says some patients have not been properly educated about the importance of their medications in layman terms. Now, we could say in layman terms, that is a synonym for simple terms. I could understand why you chose that. But it's not about the patient not understanding. It says they haven't been properly educated. So that means you, as a health professional, have not educated the patient properly. It's not about whether the patient understands. They simply haven't been provided the education. So it's not about the patient understanding. It's about whether they were educated. right? So that's actually C is wrong. Tempting, I understand, but it's not the answer. And no one chose D, I can see, because it says believe taking some pills they don't need to take others, but they weren't really talking about one pill being more necessary than another. So relatively easy to rule out D, and no one chose that. Correct answer is C. They fail to recognize that some medical conditions require ongoing treatment. And this one, perhaps you could, as health professionals, you might realize this, and let's read it. They said in the second sentence, they told me, for instance, that they don't have high blood pressure because they were once prescribed a high blood pressure pill. In essence, they view an antihypertensive as an antibiotic that can be used as short-term treatment for a long-term problem. Now, as health professionals, you know that's not true. If it's high blood pressure or hypertension, it's going to be ongoing. So that relates to B. They haven't recognized that some medical conditions require ongoing treatment. And we got a second example, others. Others have told me that they have never had a heart attack because they were taken to the cardiac catheterization lab and fixed. They had a catheter inserted, they're fixed, they're better. They don't need to take any medication, or so they believe. It's not true, of course, and that's an implied meaning. Notice how it uses different words. They fail to recognize that some medical conditions require ongoing treatment. B is correct, and 74% of people got that right. Well done, everyone. And the last sentence, as physicians, we are responsible for making sure patients understand their own medical history and their own medications. Again, it's the responsibility of the physician, which is another reason why C is wrong. It's not about the patient understanding, it's about the health professional educating. All right. Now, feel free to, if you have any questions as we're going along, to input them. Kema says, I can't see the poll. It is coming up there, so maybe something on your settings there. All right, how are we going so far? We've done 3 questions. We've got 2 more to go, everyone, or maybe 3 more if time allows. Let's continue. So the next question, what does the writer say about the side effects of medication? So we're looking for information about the side effects. And for this one, let's just go through and we might go and underline some questions. So we're looking for side effects. On exam day, you'll be underlining on your test paper. And then it says, doctors need to have better plans in place if they are to develop. So the doctors need to have better plans in place. That's what we're looking for. Should have better plans. If they obviously means side effects. B, there's too much misleading information about them online. Well, we know there's a lot of information online in the real world. We know that it can be misleading. We don't trust everything we read. But what does the writer say about it? It's not about what we may think ourselves in the real world. We want to know what the writer thinks. So we're looking for the writer's opinion. C, fear of them, again, that means the side effects, can waste a lot of unnecessary consultation time. So this fear of side effects can waste a lot of unnecessary consultation time. The patient's using all your time showing their concerns, perhaps an irrational fear, you may think, wasting time that you could use for other things, such as treating the patient. D, patients need to be informed about the likelihood of them occurring, the likelihood, all right, the chance, the possibility. That's what likelihood means, the chance or possibility. And it's the patients who need to be informed. Whereas A is talking about the doctors as a subject, D is talking about the patient. Okay, So we've analysed and read our question and answer choices clearly to understand. Now let's see if we can choose the answer. I'll give you 90 seconds to read the text and make your choice. Okay, time's up, everyone. We're back live. While you're putting in your final answers, I've seen a few comments come through. So Mavis writes, the real part C test has more words in a paragraph than this. I'm not sure, Mavis. I think it depends on the text. Not sure how many tests you've done or what your experience is. But this text we're using today is from an OET Centre published text. So that's what we're using. And I think the text is going to depend on the topic and the question. Exam stress, there are many factors at play. And if you're finding this simple, perhaps it means you're a good reader, but some questions will be harder than others. What other comments have we got? Some people are putting their answers in as we go. Favor says, so please, when should I use QAT and QTA? I mean, what kind of question? That's good, Favor. My answer to that, when to use QTA and QAT, that relates to if it's a main idea or an attitude or opinion question, I would definitely consider using QTA. However, QAT, if the questions aren't too long, and you want to just go through each one, then certainly you can try that. And my advice to you, they're both relevant strategies. You are going to have to read the text anyway, though. So I think it depends a little bit on your time management. And my suggestion is play around with those different styles yourself, see what you feel comfortable with, because they both have their validity. Certainly for myself as a reader, if I have time, I'll just read the question. I want to read that text. So personally, I always try to read all that text to understand and then go to my answer choices. But if I was under a bit of time pressure, perhaps I would start looking at the answer choices as well, just to guide me through. But probably what we don't want to do too much of is word searching, because often the answers are a little bit deeper than that. So reading and understanding is definitely the best strategy and something to aim for. All right, that's just a bit of a digression, everyone, giving everyone a chance to put in their answers. Lots of answers have come in. So all choices were given here, everyone, I'll publish that for you now. So we've got 7% chose A, but we can see it's just come up on my screen, but it's not A. And I think we can say that A is relatively easy to rule out because A says doctors need to have better plans in place, but it's not talking about having a better plan. And we'll see that as we go through the text further, but it's not saying that they need to be better than a previous plan, for example. 20% went for B. There's too much. That's quite a lot. 20% went for B. But look, it does say in the first sentence, not uncommonly, patients will say, I Googled it the other day and there was a long list of side effects, right? So there was a long list. But that's not telling us that that list was misleading. There may be a lot of information, but nothing, it just simply says there's a long list. It's not, the misleading is not mentioned. We don't know that. So perhaps if you chose B, you're implying something that's not stated. So if you want to imply meaning, you need to have evidence or clues that allow you to imply it. Don't bring in your own knowledge and imply it with your own knowledge. If you're going to imply meaning, perhaps you're going to find the synonym or some other information in the text that allows you to imply it. So it's not B. And only 3%, not much, chose C. Few of them can waste a lot of unnecessary consultation time. Well, they're not talking about consultation time here. It's not mentioned. So the answer actually is D, and 73% of you chose that. So well done if you chose that. And what do they say? We got this sentence, patients need to be informed about the likelihood. Well, we can see here a simple conversation. A simple conversation, that's to inform someone with the patient at this juncture. What does that mean at this juncture? It means at this point in time, at this juncture, can change their perspective, the way that they think. And then it says, so you have a conversation with them, and then it says, as with many things in medicine, it's about risks versus benefits. So in other words, you've got to tell them about the likelihood of having these side effects. That relates to the risk. And then versus the benefits. In other words, there are some risks, these side effects, but there's a lot more benefits. And then it goes on to say, so we get the answer here, and it says that's what we as physicians are trained to analyze, and patients can rest assured that we'll monitor them closely for side effects and address them, any that are unpleasant. All right, either by treating or by trying a new medication. So that's not really talking about A either here. It's just, this is saying what you will do. It's not about a better plan. That's something that is already in place. All right, any questions? Any questions so far? We've still got a couple more to go. If you've got any questions, you can ask now. All right, let's continue. We'll do a new one, everyone. So the question 5 says, what objection to the program does the writer make in the 6th paragraph? What objection? So something that they don't agree with. So this question is telling us, what does the writer not agree with about the program? So the writer is objecting to the program. What does the writer not like about the program? So we're going to read our text this time. So we use QTA, and because we want to find out what he objects to. So he or she objects to. So let's read through this. I'll give you 1 minute again, everyone. There's your questions, everyone. Give you 1 minute to look at your questions. Okay. Time's up, everyone. Put in your answers. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Time's up. A lot of answers coming through. And a great result again here today. Wow, 86% of you got this right. Well done, well done. So it's not, quite a few people, well, not a few, 5% went for A. It will be counterproductive. It does say in the beginning, although a simple finance incentives program has its appeal, complications abound. I mean, perhaps there's a possibility that we could say it'll be counterproductive if we imply that, but it doesn't really say it. But then we get the sentence, what's worse? So this is where the real key information comes. A few people said it will place heavy demand on doctors, but I didn't find that meaning there. We'll have a look at that as we read it in a second. Only a small percentage of you chose B. The correct answer is actually C, and 82% got it. And think about it. What this is really saying is you pay your non-compliant patients, don't pay compliant patients. It says, what's worse? It seems to be saying to society, as physicians, we tell our patients that not only do we work to care for them, but we'll pay them to take better care of themselves. And this is worse. This is a message that writer doesn't agree with this. And by the way, for all you medication compliant patients out there, you can have the inherent reward of a longer, healthier life, but we're not going to bother sending you money. This seems to be some sort of implied punishment. That's the wrong message. In other words, if you do the right thing, you don't get the money. If you do the wrong thing, if you're non-compliant, you get the money. Therefore, it's the wrong message. And notice how it's just written in completely different words. It summarizes that idea, the main idea or main objection of the writer. And wow, 82% got that right. 9% went for it will place heavy demands on doctors. It doesn't, I mean, unless you got that complications abound, but it doesn't say anything about putting heavy demands. That's not, we've got to go a bit deeper than that. I mean, you might say, sure, if you've got to start paying them, you've got more work to do. But that's not what the writer's objection is. And he's not objecting about that. He's objecting about the wrong message being sent. Pay a non-compliant patient and don't pay a compliant patient. All right. And I'll just check the comments. We're going to got time for one more very quick question, everyone. Let's do the last one, everyone. We'll do this last one quickly. Okay, so I'll put it up. What does the writer suggest about his grandmother? I'm going to give you the whole lot this time. I'm going to give you 2 minutes. See if you can find out this answer. What does the writer suggest about his grandmother? And as you're reading it, I will underline a few words. Last one's a bit of a tricky one. All right, everyone, that's time's up. Put in your final answers. I'll publish the poll. And that's great. People have done well. So no one put B and it wasn't B, wasn't mentioned. And no one put C because that wasn't mentioned. But quite a lot of you, around 15% that I can see, it's changing quickly, chose C. That's very tempting. Should have followed the doctor's advice. But actually the answer is A. And we have to look out for this word here when we're reading. This word here, but, is a bit of a clue because it says here, she died aged 87 of a massive heart attack. Had she taken her medications at appropriate doses, she might have survived it. So, and that probably would have means B if she'd followed the doctor's advice. If you only read up to the word but, you may choose answer D. But then we've got the word but. And it's what comes after but that's important. But then she'd have died, she maybe would have died a more painful death from some other ailment. Her biggest fear had always been ending up dependent in a nursing home. So by luck or design, she's able to avoid that. Perhaps there was some wisdom in her non-compliance. So in other words, she ultimately benefited from her non-compliance. Well done if you got that. So 80% of you got that. So what a terrific strike rate today, everyone. That's absolutely fantastic. That's absolutely fantastic. All right. I'm going to close this poll and I'm going to check your comments. So that's part C, everyone. So what I've noticed, and because I was putting the text up, everyone was reading from the text. So I just get the opinion from the audience. What do you think's better? Do you think it's important to read the text? Or do you think you should just word search? Personally, a big fan. I highly recommend you read the question, perhaps the answer choices before or after. But I think most cases I would just read the question stem, read through the text to understand it, then go to your answer choices and make your decision. If you read the question and each of the answer choices, then your text, you're still going to have to read those answer choices again. So the only problem I have with reading all the answer choices in the beginning is that you've somehow got to retain that plus the text. So that's why, for me personally, when I'm doing these, and what I personally believe is that you read the question stem, go through your text, understand it, then go to your answer choices to make your decision. I think it's a little bit more time effective as well. So yes, I would apply that strategy, but do practice different ways to see what works for you. And the more you read and get used to it and understand that you're looking for the deeper meaning, the better you will do. And although Part C can seem complicated, once you get used to it and the questions, it's not as hard as you may think. All right. Now, all right, any final questions before we go? Does anyone have a idea what they'd like to do in the next prep hour with Steve? What would you like to do next? We'll be planning one coming up next month. I was considering doing listening Part C. Does anyone have any opinion on that? I hope I've got through everyone's questions as well. I was asking, can I get the session on the page later? Yes, the video will be available very shortly. All right, well, thanks for coming today, everyone. I've just got one more slide. I'll just jump to this one. So just so everyone knows, we're updating our time schedule. So I know many in the audience were from different locations here today. So some of you are in the UK, perhaps some were from Egypt, some in the Middle East, some India, perhaps Singapore, and down under in Australia. So one thing we're doing now, if you go to our website, oetonline.net.au, you'll see that we've changed our time zones. So we're making sure that it doesn't matter where you're located, you'll be able to find a class time that, you know, fingers crossed, fits into your schedule. So check it out on the website if you're interested in doing more work like this, covering all 4 skills. All right, well, thanks very much for coming today. Hope you found it useful. Munza wants to do Part A. Looks like Hassam agrees with Part C. Yeah, I'll think about Part A. Thank you, Musna, for that comment. Nadia wants a writing session, please. Well, we've done about 5 sessions on writing already, actually 6. So all the prep hours have been on writing so far. So I think we'll diversify a little bit for the time being, but those videos are available for viewing. So yeah, thank you very much, everyone. We'll see you in the next prep hour. And whenever your exam is, I hope you do well and apply those strategies to your Part C. So really try to get used to using those methods and see if they work for you. Thank you very much. Bye for now.